So the brief for the session was to review the current treatment guidelines for disease-modifying treatments for patients with multiple sclerosis in the UK and how those have evolved over the last 17 years or so. And in the talk, what I tried to do was to indicate the passage from the time that the drug is licensed, the time that it is assessed by NICE, and items of the license are interrogated for cost benefit, and which of those indications are subsequently supported by NICE for reimbursement. Following on from that, I highlighted since the inception of NHS England and the two versions of the clinical commissioning guidelines for MS disease-modifying treatments, how the NICE guidelines have been slightly modified, and then latterly the new online clinical commissioning tool from NHS England, BlueTech, and how BlueTech is working in clinical practice, and again how there may be variation in terms of reimbursement for patients with MS across all of the products. So ultimately, the talk was designed to try to update general neurological colleagues around the nuances of the reimbursement criteria so that they were able to answer that question that we inevitably have in the corridor. I have a patient with X, do I need to refer them to you? Do you want to see them? And so I tried to outline the answer to that in my talk. So my main take-home point from the talk is that we currently have 13 disease-modifying treatments. There are more along the way. The treatment guidelines are continually being updated and refined, and so it's important to keep up to date with which patients are eligible for which therapies. Ultimately, for the practicing general neurologist, which patients should be referred to a disease-modifying treatment clinic for assessment for DMTs.